everybody, this is Mojan and I'm presenting my curriculum of 2020 development project. I'm one of the DMP students at the Johns Hopkins School of Nursing, and before I start my presentation, I would like to thank Dr. Doss for providing this opportunity for us to practice more on designing curriculum. My design program is about HIV DMP program, and I would like to train some nurses in doctoral nurse practitioner level, specifically about HIV/AIDS in 3 different areas about prevention plan, caring, and recovery of HIV/AIDS patients. So, why HIV/AIDS? In the United States, approximately 1.1 million people are estimated to be living with HIV infection, and this reported by CDC in 2015. In addition, 40,000 infections are diagnosed each year. As you see in Figure 5 and Figure 6, I provide these trends of HIV diagnosis by race between 2005 and 2014. And also I provide some more information about death rates among people with diagnosed HIV by state in 2012. People living with HIV in some southern states have death rates that are 3 times higher than people living with HIV in some other states. And one goal of the National HIV/AIDS Strategy for United States is for all states to reduce the death rates among persons living with a diagnosed HIV infection to 21.7 per 1,000 individuals. So that's why I believe the HIV/AIDS prevention plan is really important, and we need to train more nurses to to practice more in this area. So HIV DMP students after graduation may influence on 2 main strategies to decrease the rate of HIV in US nation, even though in international level. The first one is early antiviral therapy strategy, which has confirmed as a significant method to reduce the spread of HIV infection. Nurses has been directly involved in the HIV/AIDS prevention plan since day one, and before antiviral therapy was available, nurses mobilized in various cities to care for patients in hospitals, units, and in their homes. So this is one of the main strategies that nurses can focus on for the future plan. And the second one is about risk reduction counseling with rapid HIV testing. We need some more nurses to sit and talk with the students and with the people to just provide some information for them and just do some screening. And in addition, it's important to train more nurses about HIV/AIDS to understand the importance of prevention plan and decrease the fear and anxiety and stigma associated with caring for patients with HIV/AIDS. So the main 4 expectations and outcomes are related to 4 to 5 main areas related to health promotion, prevention, identification and intervention, treatment, and recovery supports. It's really important for a nurse practitioner to collaborate with case managers to make a plan for recovery time and home care for patients, and also providing prevention services and counseling in communities, especially schools, is really important for prevention plan of this disease. So in HIV DMP plan, we need to educate the nurses about healthcare and about the healthcare resources. We need to provide this opportunity for them to practice on their knowledge. They can practice in clinics or hospitals, and we have to have this opportunity for them to promote the healthcare system by doing some research and empower their research criteria in their practice. I reviewed a 2020 vision about national HIV/AIDS strategy, and their HIV/AIDS prevention goals in 2020, by 2020, defined as widespread testing and also improve the access treatment early for people that are infected. And it's really important to provide to improve the adherence rate for treatment for people living with HIV. And it's important to have universal virus suppression among people living with HIV and full access to comprehensive pre-exposure prophylaxis. Beside this plan, these strategies, I reviewed IMO Future of Nursing, and these two plans kind of align with each other. And they in the IMO Future of Nursing, is important to have healthier communities, provide high quality of care, just be more specific in education for nurses, improve advocacy and collaboration in HIV/AIDS prevention plan. So it's really important that the HIV strategy is it's along with IMO Future for Nursing. They both kind of following my DMP HIV DMP project. So I reviewed two similar HIV programs. One of them is related to HIV post-degree certification in Johns Hopkins, and in this, like in the Johns Hopkins, they have just the certification. Like the DMP students or nurse practitioner, they can have 12 additional credits beside 112 clinical hours to get their certification. And also I reviewed this plan for related to University of California, San Francisco. They have HIV/AIDS minor for primary care nurse practitioner students, and this is not a kind of master or DMP program. It's just kind of educational, like just some specific information about HIV/AIDS. So my DMP, like HIV DMP, is kind of new because it's just more specific, discuss more specifically about HIV/AIDS. So this suggested curriculum for HIV DMP is about 3 years and 8 total semesters, 81 credits, and the combination of classes, clinical experiences, and capstone project. The key contents is related. Key contents are related to HIV/AIDS prevention, pathophysiology, policy and systems of care, pharmacology, healthcare maintenance, clinical management, and sociocultural issues. For first year, I would like to my students to know more about the essentials in health preventions and pharmacology, clinical pharmacology, and like pathophysiology and physiology. So for the first semester, they know about a little bit about nursing practice, biostatistics, women health program. Second semester with 12 credits, they educate more about the HIV field, clinical pharmacology, and global HIV/AIDS plan. And 10 credits in semester 3 is related to health promotion and risk reduction in HIV diagnostic skills. And they have DMP practicum and also clinical reasoning and problem identification and ethical issues in HIV. Second year, semester 4, they just have this opportunity to know more about ethical issue, about research, systematic review, and also their clinical practicum will be in schools. And the semester 5, they know about HIV epidemiology and clinical practicum, DNP practicum, and 7 credits in semester 6 is related to global population health and HIV program, and HIV clinical reasoning 4, and they're like specifically going to clinics and hospitals for clinical practicum. And last year, like third year, they're just having some statistics, health information, HIV AIDS, knowing more about economics and finance affairs related to HIV, and they know about global health and in practicum 4 and DMP practicum, and they have this opportunity to implement their project. And the last semester they have this opportunity to evaluate their project. So, and it's really important to know more about the stigma reduction, fear reduction in HIV AIDS prevention plan. So the benefit of this DMP program is helping students to get their certification, is kind of narrowing their attitude about the HIV AIDS, getting more skills, and specifically know more about antiretroviral therapy, and also task sharing and task shiftings. Nurses providing essential supportive care to leading clinical treatment and antiviral therapy treatment. So it's really important, and this program satisfies these goals. So the requirement is same as other like DMP programs. Like they have to have bachelor's in nursing. They have to have like nursing license, at least 1 year experience in nursing, and resume, and goal statement. And they have to have interview with faculty to just select whoever they're interested in this program. The prerequisite is statistics 3 credits and epidemiology 2 credits. This program will accredit with CCNE, and this curriculum may use as a global program. And this is all about my presentation. I provided my references, and if you have any questions, please let me know. Thank